Hello everyone, happy new year, happy 2025. Welcome to the new year. Thank you so much for watching my videos, and we're just going to pick up from where we stopped. Today we are discussing a very important topic for everyone who is pregnant or anyone who is taking care of a pregnant woman. So we are going to discuss danger signs of pregnancy. So I have grouped them down in 2 trimesters so that it is easier for you to recognize these signs according to the trimester that you're in. And recognizing these danger signs as soon as possible is going to help you have a safe and healthy pregnancy. And many symptoms progress normally with symptoms like mild cramping, occasional dizziness, some nausea and vomiting. And these are all typical signs of pregnancy. However, there are some signs that can indicate that something is wrong. And it is very, very important to recognize them as early as possible to save your baby. So let us get started. So we start with the first trimester. The first trimester is between 0 to 12 weeks. So in this trimester, the pregnancy is normally in its early stages, meaning that the risk of complications is normally higher. And here are some key danger signs for you to be vigilant about. Number one is severe abdominal pain or cramping. So even if the mild cramping is common as the uterus stretches because of the growing fetus, sharp and severe abdominal pain is not normal. This could be a sign of a miscarriage. So severe pain accompanied with spotting can indicate a miscarriage or an ectopic pregnancy. An ectopic pregnancy is where the embryo implants itself outside of the uterus, normally the fallopian tubes. So the ectopic pregnancy is a medical emergency that requires immediate treatment because it causes severe bleeding. Keep in mind that also UTIs can cause severe abdominal pain during pregnancy because of the increased progesterone levels and also pressure on the bladder from the uterus. So have yourself checked out to rule out all this. We go to the next point. Our next point is the heavy bleeding or spotting. So some light spotting, especially in the first weeks, can be normal. For example, with the implantation bleeding, you will notice or you will see light spotting or bleeding, which may indicate that a fertilized egg has implanted itself onto the uterine lining, which normally occurs during that time when your period would be due. However, if you notice a bleeding that can be like a period or even more, this could indicate a miscarriage, as any vaginal bleeding during the first 12 weeks of pregnancy could indicate a miscarriage. So a miscarriage is a loss of pregnancy before 20 weeks. And also other complications like the endometriosis, the ectopic pregnancy, the fibroids, the molar pregnancy, infection. All these can affect the blood flow and the muscle contractions in the uterus, therefore causing the bleeding and the pain. So when it comes to the bleeding, make sure that you look out for the bright red blood, especially if this is accompanied by clots and also severe cramping or the pain. And then we go to severe dizziness or fainting. So mild dizziness or fainting is a normal pregnancy symptom. However, severe dizziness or fainting could indicate low blood pressure. So during pregnancy, there are hormonal changes that cause your blood vessels to relax and then widen. And this can cause low blood pressure and also reduce the blood supply to your brain. And also dehydration can cause dizziness. So make sure that you find out what is causing your dizziness and have it treated. Then lastly, we can talk about severe nausea and vomiting. It is normal for you to have morning sickness, but if you are unable to keep any food or fluid down, you could be having hyperemesis gravidarum, a condition that is characterized by extreme persistent nausea and vomiting during pregnancy. And this condition can lead to dehydration, nutrient deficiencies, and weight loss, putting both the mother and the child in danger or at risk. So if you know that you're experiencing this, make sure that you have it managed as soon as possible. So with that, the first trimester or the danger signs in the first trimester are finished. Let us go into the second trimester. The second trimester is normally between 13 to 26 weeks of pregnancy, considered as the easiest phase of pregnancy. However, there are some important danger signs for you to be aware of. And number one is unusual or severe abdominal pain. Now, severe pain during the second trimester can be a warning sign of preterm labor, which is not a good sign. Then placenta abruption, where the placenta detaches from the uterine wall, can also cause severe abdominal pain. So pay attention if the pain is accompanied by bleeding or even changes in the fetal movement. Please go and see your healthcare provider immediately. So also mothers complain of severe headaches and visual disturbances. So now if you notice persistent headaches, especially those ones that are not responding to over-the-counter drugs like paracetamol, ibuprofen, this could be a symptom of preeclampsia. Now, preeclampsia is a condition that involves high blood pressure and protein in your urine during pregnancy and childbirth. So if also a mother is complaining of blurry visions, that seeing spots, flashes, or even complaining of temporary loss of vision, this is serious and it could be a potential risk to both the mother and the child. So make sure that you see your gynecologist, because this could be a pregnancy-induced hypertension or gestational high blood pressure. Then there is also sudden swelling of your hands, feet, and the face. Although there is that normal swelling during pregnancy, especially around the ankles, sudden or severe swelling of your hands, feet, and the face can indicate preeclampsia. I've already mentioned that preeclampsia is a serious condition that involves high blood pressure, and this can cause damage to organs, especially the liver and the kidneys. This condition can progress rapidly, and you've seen that women gain weight rapidly. So make sure that you go to the hospital, find out the cause, and have it managed. But you can also try lying in your left lateral position. So make sure that you put a pillow or pop up your feet or your legs when you're seated. Avoid high sodium foods. I mean foods that have a lot of salt. And I've also seen some women wear support socks. So you can try out any of these points or the tips. You never know, they might help you out. So make sure that you are monitoring any unusual discharge in the second trimester. For instance, a thin, watery discharge during the second trimester can indicate premature rupture of membranes. And then a bloody, mucus-like discharge can indicate preterm labor. And it is concerning if it is accompanied by bright red or severe cramping. That means that someone is going into labor. But remember here, the baby is not even ready, or you're not yet ready for labor. And then other causes like placental previa. So this is a condition where the placenta covers all or part of the cervix. This is where the baby is going to pass. And then I already talked about placental abruption. This is where the placenta detaches from the wall of the uterus. These are both concerning cases for both the mother and the baby. And these two can also occur in the second and the third trimester. So make sure that if you notice any discharge, watery, mucus-like, and mucus-like, if you notice blood in it, bright red blood, this is very, very concerning. So make sure that you go to the hospital immediately. Then we go to the third trimester. Now the third trimester is between 27 to delivery. This is the last phase of pregnancy and the body is preparing for labor. However, there are specific danger signs that you should not ignore. Number one is decreased or no fetal movements. Now, feeling your baby move regularly is a good sign that your baby is doing well. However, if you feel like you're no longer feeling your baby move, your baby's fetal movements have reduced, or their pattern of movement has changed, make sure that you call your midwife and your gynecologist immediately. Do not wait for the next day. Then there is also severe or persistent back pain. So now some back pain is common because as your baby grows, especially due to the weight gain and also some posture changes. Because as the baby grows, they put pressure onto our spine, and then of course you get the back pain. And then of course you're not going to sit the same way as you seated when you're not pregnant. So also the posture can bring the back pain. However, if you notice sharp, severe or cramping pain, this could indicate preterm labor or other concerns like kidney infections, UTIs, and if this pain is accompanied by contractions or bleeding, make sure that you seek medical help immediately. You have also heard of some women complaining of severe shortness of breath. Yes, this is another danger sign in the third trimester. So shortness of breath is expected during pregnancy because the baby is putting pressure onto your diaphragm. So your uterus is going to expand upwards, and then your blood volume is going to increase, and then your body adapts to the hormonal changes. However, if you notice severe shortness of breath or difficulty in breathing, this could indicate pulmonary embolism. This is when you have a blood clot in your lungs, and then pneumonia, and in some rare cases, heart issues. So if you've been noticing this for some period of time, make sure that you go to the hospital and have this checked out. So lastly, we have premature contractions before 37 weeks. So contractions before 37 weeks can indicate premature labor. If you notice contractions that are not going away, even with breast, or contractions that are now getting closer, like what I mean is the time. Now, like the time in between, like now it's like a minute or maybe seconds, and then you get another contraction. So the contractions are now getting together. please go to the hospital immediately. Those are some of the danger signs under each trimester. So I just want to give you general danger signs throughout pregnancy that you can just look out for, or that can happen at any point of pregnancy. Number one is high temperature above 38 degrees. So high temperature in pregnancy can indicate that the mother has an infection, they have a cold, they have an ear infection, they have a UTI. And high temperatures during pregnancy are very, very dangerous, especially in the first trimester, as this can affect the fetal development. Number two is blurry vision or severe headache. I already talked about this. This can happen at any point during pregnancy. So of course, this indicates high blood pressure, that is preeclampsia. So you have to make sure that you are monitoring the mother's BP, you're monitoring and managing the preeclampsia. If you do not do that, then a complication called eclampsia is going to develop. So the mother will be confused, disoriented, they'll get seizures. So make sure that if a mother is complaining of severe headache or blurred vision, make sure that you manage the preeclampsia immediately. Then there is also persistent vomiting. This can happen throughout pregnancy. So I already talked about it also. If a mother is persistently vomiting, that means that this mother is going to have severe dehydration, severe weight loss, and even nutrient deficiencies, which are going to affect both the mother and the baby. So make sure that you have this checked out and seek medical help immediately. Then there's also sudden weight gain. I also talked about this. This means that a mother has preeclampsia, especially if the mother is swelling the hands, the feet, and the face. So this can also happen at any point of pregnancy. Watch out. Then lastly, we can talk about the discharges. The discharges, I already talked about them. The watery discharge, the mucus-like, plus that bloody discharge in the mix of it all. The watery discharge can be premature rupture of membrane, and then the bloody mucus-like can indicate preterm labor. So make sure that you watch these things. So make sure that you be careful and watch for these danger signs throughout pregnancy, because these can happen at any time of pregnancy, at any stage of pregnancy, at any phase of pregnancy. So make sure that you watch out. In summary, if you're experiencing any of these symptoms, make sure that you contact your healthcare providers, your midwife, your gynecologist, or go to the emergency room immediately. It is better to be overly conscious than to miss out a warning sign. Remember to follow your instinct, because there is no concern that is too small when it comes to the well-being of you and that of your baby. And then here are some of the tips for monitoring pregnancy health. Number one is prenatal checkup. Make sure that you attend all the scheduled appointments of these prenatal checkups, because they're crucial for monitoring the well-being of the baby and also for that of the mother. Then know what is normal for you. Every pregnancy is normal in its own way, but a mother will know what is normal for them and what feels off. Then build a supportive system. Make sure that you surround yourself with a supportive partner, family, friends, healthcare providers, because these healthcare providers, the midwife, the nurses, the gynecologists, they are going to assist you to be sure of some of the symptoms that you're not sure of. And then the last point, document your symptoms. These symptoms can be mild, but a pattern or a change in these symptoms can show you that there is an issue. So document your symptoms. Other than that, thank you so much for watching. Feel free to leave a question or your experience in the comment section. And don't forget to like, share, subscribe, and hit that notification bell so you don't miss out on any of the videos that I post. And another thing, remember to always follow your instinct.